Also known as cerebrovascular accident, a stroke occurs due to a sudden blockage of blood flow to the brain. It contributes to approximately 1 out of every 20 deaths. The following major risk factors enhance the occurrence of a stroke. Number 1. High blood pressure. Hypertension is one of the leading causes of stroke as it adds additional strain on the arterial walls. Hypertension also promotes arteriosclerosis, during which the arterial wall gets harder and narrower, increasing the risk of blood clot formation. Eventually, the weakened arteries in the brain rupture due to extra pressure. Number 2. Heart disease. Cardiovascular illnesses account for 25% of stroke cases. Atrial fibrillation, or irregular cardiac rhythms along with defective valves, may lead to stroke among most cardiac patients. Atherosclerosis, or accumulation of fatty plaque in the arteries, can promote blocking of arteries supplying blood to the brain tissue. Number 3. Diabetes mellitus. Individuals with diabetes are 4 times more likely to develop a stroke. Hyperglycemia, or excessive blood glucose concentration, can enhance the risk of fatty deposits in the arterial walls, further leading to blockage in blood flow. Moreover, excess glucose in the blood also leads to long-term damage of blood vessels. Number 4. Smoking. Upon inhaling the cigarette smoke, hazardous chemicals like carbon monoxide and nicotine enter the bloodstream. Carbon monoxide reduces the ability of red blood cells to carry oxygen, while nicotine causes hypertension, abnormally increased heart rate, and leads to narrowing of the arteries. Smokers have a 70% higher chance of experiencing cardiac arrest and stroke. Number 5. Obesity. Being overweight raises the risk of ischemic stroke among young adults, during which blood flow, and hence oxygen supply, to a part of the brain is hindered. Obese individuals have higher blood cholesterol and lipid levels, making it more likely for fatty plaque to deposit in the arteries. Embolus formation may occur, leading to death of neurons in the brain. Number 6. Family history. Genetic factors play a major role in heart disease, high blood pressure, and stroke as well. Several illnesses transmitted through hereditary, such as sickle cell disease, also increase the risk of developing stroke. Members of the same family may have a genetic tendency of other stroke risk factors, such as hypercholesterolemia and obesity. Number 7. Poor dietary habits. Several new studies illustrate the link between unhealthy eating habits and stroke quite vividly. Almost half of the deaths caused by stroke are a result of poor diet. Consuming processed meat, highly refined carbohydrates, excessive salt, and sugar can lead to cardiovascular diseases and ultimately stroke. Number 8. Lack of exercise. The cardiovascular benefits of regular physical activity include regulation of blood pressure and blood glucose levels, along with prevention of obesity. Individuals who exercise regularly have a 27% lower risk of developing ischemic stroke. Furthermore, exercise improves blood vessel functioning and strengthens the cardiac muscle, preventing blood clot formation in arteries. Number 9. Excessive alcohol consumption. Research reveals that alcohol has been linked to 8% of strokes caused by blood clots in the brain and 16% of bleeding strokes. Heavy drinkers are at a higher risk of stroke earlier in life because it triggers arterial fibrillation and raises blood pressure to alarming levels. Alcohol-induced liver damage can also affect blood clots. Number 10. The use of illegal drugs. Intravenous drug abuse causes stroke by the formation of cerebral embolism. Cocaine and amphetamine are psychomotor stimulants that greatly enhance the risk of both ischemic and hemorrhagic stroke by causing a surge in blood pressure along with vasospasm, or sudden constriction of arteries.